Hey everyone, let's dive right into this explainer. Today, we're investigating a very specific and honestly often terrifying mechanical failure in animals, the breakdown of swallowing. Medically, we call this dysphagia. We're going to look closely at the clinical data to solve this swallowing mystery, breaking down exactly how things go wrong, how to pinpoint the cause, and most importantly, what we can do to fix it. But look, before we get bogged down in all the heavy medical terminology and diagnostic procedures, we've got to establish the real-world stakes here. Watching a beloved pet, whether it's a dog, a cat, or really any animal under your care, gag, retch, or choke while they're just trying to eat, it's incredibly stressful. It triggers immediate panic. But when we look at the clinical reality, this isn't just random choking. It's a highly specific mechanical breakdown. It's like a giant puzzle. And it's a mystery we can totally solve together by systematically breaking down the mechanics of what's actually happening inside the animal's body. So what exactly does dysphagia mean at a foundational level? Well, dysphagia is defined simply as difficulty in the normal process of swallowing. More specifically, it's the disruption of moving food or water from the mouth all the way down to the stomach. Basically, it's an umbrella term for a breakdown anywhere along that very specific transit route. To solve this, we're going to follow a pretty logical path today. 1. Anatomy of a swallow. 2. 3 types of dysphagia. 3. Common causes and signs. 4. Playing veterinary detective. And 5. Treatment and nursing care.
All right, starting us off, Section 1, Anatomy of a Swallow.
You know, swallowing is actually this highly coordinated, multi-stage sequence. It is definitely not just one action. The normal anatomy follows a really strict path. It begins in the mouth, right? That's where food is gathered and chewed. From there, it gets pushed back into the pharynx. The pharynx then coordinates a complex reflex to send that food down into the esophagus. And finally, the esophagus acts as a transit tube, propelling the food or water down into the stomach. Every single one of these 4 stations has to work in perfect, seamless harmony. If there's a roadblock or even a nerve failure at any of these 4 points, you've got a problem.
Moving right along to Section 2, 3 types of dysphagia.
Now, what's really interesting here is how we can pinpoint exactly where that normal anatomical process breaks down. When evaluating a patient, we can divide dysphagia into 3 distinct types based on those stations we just covered. First up, oral dysphagia. The quick exam tip here is simple. They can't chew. By definition, they're having difficulty picking up or chewing the food in their mouth. Second, pharyngeal dysphagia. The quick tip, they can't swallow, meaning the mouth works fine, but they struggle moving the food from the mouth into the esophagus. And third, esophageal dysphagia. The tip here is that they can't get food down to the stomach. The food makes it past the throat, sure, but there's trouble moving it through the esophagus and into the stomach. By observing exactly where the breakdown happens, you can immediately categorize the type of dysphagia you're dealing with.
Which brings us to Section 3, Common Causes and Signs.
So as an observer, you need to quickly look out for a wide array of alarming clinical clues at our crime scene. The most obvious is outright difficulty swallowing, usually accompanied by gagging or retching. You might see the animal making repeated, really exaggerated swallowing attempts, like stretching their neck out. Look out for excessive drooling, too. Clinically, we call that tialism. You'll also likely see regurgitation, which is the passive backward flow of undigested food. Keep in mind, that is completely different from active vomiting. Coughing or choking while eating? Massive red flag. Over time, all of this leads to weight loss because the animal simply isn't getting calories. And here's a highly specific clue for you. Nasal discharge after eating. This happens if the food fails to go down the pharynx properly and instead gets pushed upward, straight into the nasal cavity. Once you spot those signs, it's time to round up the usual suspects. And they really run the gamut from simple, acute physical obstructions to complex chronic diseases. A classic cause is a foreign body, maybe a swallowed bone, a stick, or a piece of a toy lodged in the mouth or throat. Dental disease and oral pain can easily cause oral dysphagia, just because it hurts too much to chew. Then we get into the tricky stuff, like neurological disorders. Take myasthenia gravis, for instance, which disrupts the nerve signals required for the muscles to actually swallow. You might also be looking at esophagitis, which is inflammation, or an esophageal stricture, basically a structural narrowing of the tube. We've also got to mention megaesophagus, a condition where the esophagus loses its muscle tone and just balloons out. And finally, tumors, masses, or blunt trauma can physically block or damage the whole pathway. Okay, Section 4, Playing Veterinary Detective.
To actually nail down the specific culprit, a vet's toolkit is pretty extensive, and it escalates logically. It always starts with a foundational physical and oral exam to check for obvious dental issues or foreign bodies. And because swallowing is so dependent on nerves, a neurological exam is absolutely critical. From there, we move up to imaging. Radiographs or x-rays can spot obvious blockages or megaesophagus. If standard x-rays aren't cutting it, vets use a contrast esophagram to highlight the esophageal lining. For a direct look, an endoscopy puts a camera right down the throat. If they need to see the swallowing motion in real time to catch a neurological misfire, they'll escalate to fluoroscopy, which is essentially a dynamic moving x-ray. And of course, your foundational blood tests, like a CBC and biochemistry panel, help rule out systemic diseases.
But here's the catch, and it's a big one. This entire process is a high-stakes balancing act. On one side, you're running all these tests to hunt for the cause, but on the exact same timeline, you are racing against the clock to prevent some really life-threatening complications. You can't just fixate on the diagnosis and ignore the immediate danger to the animal. The most critical complication is aspiration pneumonia. Actually, scratch that. Severe dehydration and malnutrition are just as urgent because the animal literally can't take in sustenance. But yeah, aspiration pneumonia is huge. It happens if food or water is accidentally inhaled into the lungs instead of swallowed. Plus, stagnant food sitting in the esophagus can lead to severe esophageal ulceration. So, diagnostics and preventative care, they have to happen at the exact same time.
Finally, Section 5, Treatment and Nursing Care. The overarching golden rule for medical treatment here is that you absolutely must target the underlying cause directly. You aren't just treating the symptom of dysphagia, you have to fix the root problem. If there's a foreign body in there, it's got to come out, often via endoscopy. For medical management, vets rely on specific medications like antibiotics to fight aspiration pneumonia, anti-inflammatories to reduce swelling in the throat, and gastroprotectants to soothe an ulcerated esophagus. And in more severe cases involving tumors, masses, or really rigid strictures, surgery is often the only path forward. But listen, medical treatments and surgery, that's really only half the battle. The other half is meticulous nursing care. The daily actionable steps are absolutely vital. Take elevated upright feeding, literally a game changer, especially if you're nursing a pup with megaesophagus, because it uses gravity to help pull the food down into the stomach. Feeding a soft or slurry diet aids in easier swallowing and takes way less muscular effort. You've got to constantly monitor their food and water intake, plus their body weight, to actively prevent that malnutrition we talked about. Keeping highly accurate daily records of regurgitation or vomiting episodes is also key because it tracks if your treatment is actually working. And in the really severe cases where the animal simply cannot swallow safely at all, using a feeding tube might be necessary to bypass the whole shebang while they heal up. When you step back and look at everything we've covered in this explainer, the entire clinical approach just boils down to this one simple golden rule. Identify the type. Is it oral, pharyngeal, or esophageal? Find the cause. Use your diagnostic toolkit to pinpoint that physical or neurological roadblock, and treat accordingly. Apply the right medical interventions and nursing care based strictly on that root cause. It's a beautifully logical, step-by-step pathway to saving the animal. So, I'm going to leave you with this final thought. Since our pets can't exactly speak up and say, hey, my throat hurts or food feels stuck in my chest, they rely entirely on our powers of observation. Are you watching your pet's daily eating habits closely enough to catch those subtle early clues of dysphagia? Observing their normal everyday routine is the very first and arguably the most important step in being the proactive detective they need when things go wrong. Keep your eyes open and, you just might save a life.